Oh,
To
so
assist the
quiet.
nurse, to assist the nurse, ma'am, and to provide proper healthcare to the patient.
To assist the nurse. Yeah, you must know that you are always under the nursing law. Okay? And as a nursing assistant, you have your basic function. So again, everybody does know your basic functions are? What are the basic functions of a CNA? Whenever you go out there to give your CVs during the interview, the first thing that they will ask you is, what is your basic function as a CNA? Okay?
The basic function, we are patient-oriented, helping patients, assisting patients so that they're on their day-to-day activities, daily activities.
Okay. So your basic function is assisting and supporting nurses in performing the activities of patients in daily living. So what are those activities before we start? Okay. What else? Okay. What else? Stop from there. Okay. What else? Okay. What else?
Bed making.
Housekeeping if there is no housekeeping staff. Caregivers, yes. But CNAs, no, as much as you have your housekeeping staff. Caregiving, as I said, yes. Housekeeping, yes. But if there is no housekeeper, yes. But for you as the CNA, you have the ADL. And what consists of ADL are those in this card which we are going to take. Okay? So starting when someone asks you, your ADL includes, number 1 is to proper hand hygiene. Second, you will do your vital signs taking. Third, you will do your bed making, body mechanics that consist of positioning, transferring, lifting, carrying of patients. What else? Tracheostomy care, oxygen administration, suctioning, simple wound dressing, NGT insertion and feeding, constipation management. What else I missed? NACE, I mentioned, NGT insertion and feeding. What else? And if they will ask you, nursing aides do not give injection. Okay? You knew it that mostly our patients are elderly with chronic diabetes, so we just added it to our ADN. So our function, basic function is to assist and support the nurses in performing the patient's daily activities. Okay? And that includes all of those plus diabetic management. Fine? So we are not supposed to give injection, but we will give injection by giving insulin only. And that insulin, what is the route that we are supposed to give? Subcutaneous. You have to remember that. There is only one injection you are supposed to give, and that is subcutaneous. Okay? So we're clear. Done. So you know what is the difference of caregiving and CNA? Who are caregivers here?
In Philippines.
Okay. So, do you know the difference between the CG and the CNA?
Yes, ma'am.
Okay, so what is the difference between the two?
Because the CNA is almost the same, but the housekeeping with home, what is this one? Everything you need to do in the home, including
Everything you does in the home.
the cooking and cleaning. It's
Okay.
depends on the patient.
Ironing,
Yes, ma'am. Everything.
marketing.
Yes, budgeting. As my experience before in Philippines, I working 9 months. So my patient is diabetic and she's disabled and she cannot walk at all and blind. So I do everything and I take budgeting from supporting from her family. So I do everything and call ambulance to bring her and check up and call the medtech to check her blood, laboratories, everything. We need to arrange it.
Okay, so what's the difference now if you are in the CNA?
CNA man without home what is it? Doing at home.
So
Like
when they
cooking and
are
housekeeping.
assigned at home, so what they will do?
Ma'am, again?
If the CNA will be assigned at home,
You will care only the patient without doing the without the housekeeping, cleaning and cooking.
household.
Yes, household. That.
Okay?
Yeah.
So that is the two difference. Okay? You CNAs, you are not supposed to work in a home care. But since people, they are requesting you personally, so you can go with the home. Okay? Privately, personally, if they want to take you, so you will be working at home. But otherwise, only the caregiver does the home care. Okay? So you know now the difference. If somebody will ask you why you are not caregiver, so you should know what to answer. Okay then? Okay, so let's proceed now. We are going to talk about vital signs. If you want to take your video, fine. Because I don't want, when you come for your finals, you will tell me, Ma'am, I did not, you did not. Okay? So that is my proof that I taught you this. Okay? So now, let's proceed with vital signs. What is vital signs? As I said, we should know what, why, and how. So first, what is a vital sign? Signs means to say signs. More than one.
Body function, like temperature.
Okay, Janet?
Vital sign is a clinical measurement of the human body.
Okay. So, vital signs is a clinical measurement of a human body's function. Function of a human body. So, we need to measure it. Why? So, why do we need to measure? One, so to have a baseline comparison. Means to say, if the doctor will see that the patient has 39.5, so again, you will repeat to check the measurement, and after 15 minutes, you will be having a report of 38.5. So the doctor will base on the previous baseline together with the new measurement that you have taken. So it's a baseline of comparison. One. Second is for the effectivity of the antibiotic therapy. So the doctor once again will see a patient. And the patient, he or she will be prescribing medication. So after 3 days, patient comes back and the doctor will check whether this antibiotic is effective or no. So then, with the vital signs, so the doctor will know exactly whether this prescription of medication is effective. Third, for nutritional assessment. Patients who are coming to the hospital, not all thin are not all thin are malnourished. Not all obese are malnourished. Okay? So only with the doctor's collaboration with the nutritionist or the dietitian, only then the nutritional status of a patient will be assessed through your vital signs. Vital signs, most importantly, is the height and the weight for the nutrition assessment. The last one is whenever the doctor gives or order a blood transfusion, so it is to check the blood transfusion reaction. By the temperature, if the doctor will see that the temperature is more than above the normal, so automatically that blood transfusion will be stopped or hold because it can cause a patient death. Okay? So I'm going to tell you from starting today till you completed and finish your practical and the level 4, you have to know that our main goal is patient safety. The quality of care that we want to give to the patient outcome should be safe. And definitely for us, we will be safe too. You do not keep yourself always at the risk side. Okay? Remember that we are or you are going to handle a live patient. From now on, as we do our practical, consider this Baba here as alive. Okay? Say hi to Baba. Hi. Because this one, you are going to be with Baba from the time you are here. Okay? So consider Baba here as alive. So that you will know how to do your care, your procedure with care. I said, nursing is doing it from your heart with the care. Okay? So now, 4 whys. You got it all? Okay. Now, in doing every procedure, we have a universal protocol. Means to say, all procedures that you are going to do, you have to perform your universal protocol. Number 1, hand hygiene. Why hand hygiene? We did not go to the hand hygiene yet. But why hand hygiene?
To prevent the spread of infectious diseases.
To prevent the spread of infection from one person to another, from patient to us, from us to others. Okay? To protect ourselves, to protect our patient. Second, cups. Collect, arrange, prepare, and if you have medical equipment, sanitize. Okay? Equipments before and after use, you have the 5 moments of hand hygiene, right? So equipments before and after use, you have to sanitize. Next, you have to check if your medical equipment is working. I do not want you have your medical equipment like you wanted to check the heartbeat of the patient. And when you come to the patient to check it, you will not hear anything. Yeah, because before you came to patient, you did not check your stethoscope, right? So shameful if you will come to the patient. I'm sorry, ma'am, this stethoscope is not working. You can say that? No. Okay? So the next thing, after the cups, after the medical equipment disinfection, so what next do we do?
Introduce yourself to the patient.
Introduce ourselves. Never, never come to the patient without introducing yourselves. You do not just grab your patient. I will do your temperature, ma'am. No. You have to introduce. Every day when you come to your patient, who knows? Your patient is with dementia. Okay? So just even he or she don't know you or appreciate you, you have to do your part. Okay? Introduce yourself. Ma'am, I'm Ann. I'm your new CNA for today, and I'm going to take your oral temperature. Next.
Ask the patient's name.
Okay? Identify
Identify
your
the patient.
patient by two international identifiers. What are those two?
Name and date of birth.
Ask the name and ask the date of birth. You do not
Ask the
forget
name.
asking. Okay? You do not tell one. No. If the patient still groggy from anesthesia, and you ask the patient, "Hello, Mr. Smith," patient will just, then you give the medicine, which is not supposed for Mr. Smith. Okay? So, two, asking name and date of birth. If the patient is unconscious, what you should do?
Check the file or
As the member,
the relative
family member.
Check the ID band and ask the family member for ID or passport. Okay, next. Safety of the patient. Safety means you can lock the wheel of the bed, you can raise up the sidewell on the other side. In the place where you are going to do your procedure, you have to put it down. And next, provide privacy. If three beds together here, so just draw the curtain, cover your patient, you do not expose your patient. So if the patient is in one room, just close the door or lock the door. Okay, next? Appropriate PPE. Why we said appropriate PPE? So it depends on your transmission-based precaution. What are the transmission-based precaution? Airborne, droplets, or respiratory, and no, everybody stop. Contact. Okay? So, appropriate PPE. You should not come to the patient, I'm afraid this patient had something. You know the history. So, you should know before you come to your patient what the patient has. And according to that condition, you prepare your PPE. Not always when you come to the patient, you have to wear your gloves. It's appropriate PPE. Now, those are our universal protocols which we need to memorize. Excuse me. Okay? So now, let's go with our procedure. As I said, how many vital signs do we have? What are those four? Okay. So don't you know that we have 7? Okay. So in that 7, we have body temperature. What else? Pulse rate, respiratory rate or respiration rate, blood pressure, oxygen saturation, height and weight. There are 7. Okay? Okay, so we have 7. Now, we will start with body temperature. In taking body temperature or all of those vital signs, you need to memorize. Again, memorize the value, the normal value. Because if you do not know the normal value, you won't know that your patient is already deteriorating. Okay? What is the normal body temperature of a human body?
37 degrees.
Wow, everybody's in chorus. 36.5 to 37.2. Regardless with your axilla or rectal or any place. You have. As I said, we will start with body temperature. In body temperature, we have 5 ways to take it. So what are the 5 ways?
Oral, temporal, rectal.
Oh, I love this chorus. You know why? When I said I love the chorus, because the other one is talking, I will hear and you will say it, right? But if you will be talking alone, you talk yourself. Okay. So, Yala Antoinette, why are you waiting? You want to talk? Yes, I'm giving you the chance. I said, I asked, what are the 5 ways of taking body temperature?
Orally,
By
by the mouth,
Axillary.
by the skin,
axillary by the armpit, under armpit. You give her the chance.
by the skin, and tympani, by the ear.
Then one more. There are 5, right?
Rectally,
Rectally. Okay. So we have 5 ways in taking body temperature. So as we said, body temperature, it differs when you take it from different part of the body. But it is, the normal of a human body is 36.5 to 37.2. So axilla is 0.3 plus 0.3 or minus plus. I'm not quite sure. Huh?
I think that one is lower.
Rectal is down, axilla is up. Okay, 0.3, 0.7, something like this. Okay, as long as you know the normal. Now, so we have 5 ways. So, what are we using in taking oral, axilla, and rectal?
Thermometer.
Okay. So this is digital thermometer. So this digital thermometer has, what do you call this?
mercury.
Hello? Is there any mercury here?
No.
Who taught you there is a mercury?
The color.
The color will see, you will see the color as mercury. This one?
That one?
Long time ago, we have the mercury. But since mercury is poisoning, so they banned it and changed with digital thermometer. So this is a digital thermometer. So where are we going to use this kind of thermometer?
Oral, axillary, and rectal.
Oral,
Axillary
axillary.
and rectal.
Who said that this is for oral and axillary? Why you are afraid to raise up your hand? This is for oral and axilla. Who said no? Why when I ask is this? So only few raises up their hands. So what about the others? No?
Confused.
Or you don't know? Not confused. You do not know. Okay. Difference between oral, axilla, and rectal. This is a tip, right? So for the oral and the rectal, we use digital thermometer with a tip. For the rectal, we uses rectal bulb. Okay? So, you have seen your rectal bulb thermometer? So, never use or never interchange this. You use here and you use okay? That is a big, big no. Okay? So, better be sure. You will not be using that. Okay? You should know this is tip longer. And the bulb for the rectal is shorter and bulb. Okay? So, sample. Okay? So, you should know what is rectal bulb. But it so happened that it is different bulb. Okay? So this is the difference. Okay? So you will know it is longer, it is bulb, rounded. Okay? You cannot put this in the rectum. Fine? Clear? Okay. Now, so what we need to use when we are taking oral and axillary temperature. So we will be using, whenever you come to the patient, you better bring your tray. Tray with your kidney basin. Always this is going to be your friend. Anytime you come to the patient, bring this. You do not come to the patient, Ma'am. No. Take this kidney basin with you. You need the thermometer, whether it is oral or rectal, it depends. Then you will be needing a gauze and alcohol swab. Okay? So we will be performing oral temperature taking. So when we take, as we said, universal protocol, we already disinfected our thing. Okay? Never put your material or equipment on the patient bed, aside from or instead, keep it to the bedside table. Never put them on the patient bed. Or, you have the Mayo table, keep it on the Mayo table. Okay. So now, I come to the patient. This is already disinfected. Ma'am, I want to take your oral temperature. Hold the chin. Ma'am, can you open your mouth? Your tongue, lift your tongue. Okay? Under the tongue, I will place your thermometer. Under the tongue, put it on. Wait for the beep. Once it's beep, beep. Okay? Take it out. Read and remember. Okay? Keep the patient. Set aside. Hand hygiene. Go back to the patient. Keep the patient in a comfortable position and document. Only then, sanitize your equipment. Fine? 2. We are with axillary. In axillary, in taking axillary temperature, here, ma'am, I will raise up your arm, insert, it should be here, next to you. It should not be crossing. But just to show it to you, I'm crossing. Okay? Assuming that this patient is alive, I said. So, we should never do it. But since I wanted to show it to you, so here to the side, I'm doing it. So, raise the arm, insert, keep the arm back, snug the shoulder. Snugging means keeping it closed. Hold, thermometer, put it on, wait for the beep. Once it's beep, ding, ma'am, done. Open slowly, gently, take out, read and remember. Set it aside the same way. Hand hygiene. Go back to your patient. Keep the patient in a comfortable position and document. Sanitize your equipment. 2, 3. What we will do is rectal temperature taking. In rectal temperature taking, we have rectal valve. Okay? Remember, we need lubricant jelly. This is not the jelly itself, huh? So, just assuming this is jelly. So, what we have is, we have KY jelly is the brand. So, it is in a tube, okay? And if you do not have this gel, you can use oil. Olive oil, but not that frying oil. Okay? So, with the lubricant, with the gauze, kidney basin, we will come to the patient with the glove. All rectal procedure, you must wear gloves. Okay? So, coming to the patient, now, we will position the patient on a left lateral. Left lateral position, scooping, shoulder. Ask the patient to bend the knee, scoop, turn to left, hold the patient at the back, body aligned straight. Okay? One leg straight, other leg bended over the knee. Okay? Now the patient is on left lateral. Why left lateral? It could be right? So why left? Okay. So it is the small intestine, the position of the small intestine is connected in or to the rectum. Okay? So now, all rectal procedure, rectal exam, rectal thermometer taking will be on the left lateral. Okay, now, as you put the patient on a left lateral, take your glove. So this is disposable. So it doesn't matter whether left or right. Okay, so disposable glove. When you are having this as in with a bubble or something, or you want to keep it like that, you do not shake. Okay? Just hold it and form a bubble to do it. Okay. So I'm with my glove. Okay. Get your gauze. So squeeze some of the lubricant. Coat the tip only. We are going to insert only up to the tip. You do not insert the whole thing. Only the tip. Okay? So, coat the tip. Hold the patient. Pinch. Insert. Put it on. Wait for the beep. As soon as it beeps, take it out. Read and remember. Set aside. Get a gauze. In. Circular. Out. Receptacle. Another. In. Circular. Out. Receptacle till it is clean and dry. Okay? Dry and clean. Now, so keep the patient as this position. Okay? All all your things, either you disinfect, take it out all to the medical, take off your glove from the middle. You remember that this is dirty. Hold it, clasp it, under with the 2 fingers, out should be not dangling. Put in receptacle, hand hygiene, hand washing, go back to the patient, put back the patient back to the lateral, from supine, same way, back to the shoulder, scoop the shoulder, scoop the knee, back to the position, keep the patient on the diaper, the cover, the blanket, and document. So if you did not take all of this to the medical waste, so take it to medical waste. Okay? Then document. 3, 4. We have done 4.
That one third.
Tympanic.
Tympanic 4.
So we have tympanic ear thermometer. This is tympanic thermometer unit, a thermoscan, this is a thermoscan, this is the ear cup, disposable ear cup. So after you clean, disinfect, attach the ear cup, come to the patient, okay? Now, we will go to the ear. Ma'am, I will be taking your tympanic temperature. Hold, tag the ear. Tag means pull it up to open the canal. So, tag the ear, insert, put it on, wait for the beep. Once it beep, take it out, read and remember, set it aside. So, hand hygiene, go back to the patient. What else? Keep the patient comfortable and document. Document. We already did the hand hygiene. Now, 1, 2, 3, 4, 5. You know that we have our temporal or by the skin. Either it will be the same as the thermoscan. This is everybody is doing it nowadays. Common. So this thermoscan, just to your skin and it will register. Okay? So after that, same thing, disinfect and document. So that is the 5 ways of taking body temperature. You want more?